Hey, my name is Brody. I'm going to be your nurse today. I'm going to close the curtain, give us some privacy, perform hand hygiene. Can I check your wristband right quick? All right, can you clarify your name and date of birth for me?
Ethan Lay, October 5th, 99.
Right, you know where you are today?
The hospital.
You know why you're here?
Assessment.
All right, patient is alert and oriented times 4. Today, I'm going to be doing a head-to-toe assessment on you. It's going to involve me touching you a little bit and listening to your heart and lung sounds. Is that okay?
Okay.
All right. Patient does appear to be in any distress. He appears to be his stated age. He responds appropriately and well to questions when asked. He's sitting in an upright position. Clothing is in good repair and appears to have quality hygiene. All right, can you stand up for me right quick?
Okay.
Take a few steps forward for me if you don't mind. All right, can you walk back to heel to toe? All right, have a seat. Patient's gait is smooth and steady without the need for any assistive devices. I'm going to assess your vital signs real quick if that's okay.
All right.
All right, we're going to start with the temp. Check your O2 set. I'm going to check your pulse rate. .5 Fahrenheit temp. Heart rate of 72 beats per minute, 16 respirations, and we got a 96% O2 set. I'm going to check your vitals right quick. Check your blood pressure, I mean. Put it around there, too tight.
No, that's good.
All right. Go. Looking at a blood pressure of 122/83. Alright, now we're going to do your skin, hair, and nail assessment. Upon the initial inspection, skin is uniform and appears to be evenly colored on both upper and lower extremities. Skin is also appropriate for the age and ethnicity of the client. If you don't mind, I'm going to palpate you right quick. Alright, skin is warm to the touch on both upper and lower extremities. It is smooth and dry, smooth texture. If you don't mind, I'm going to check your skin turgor right quick. Just a little pinch on the chest here. And skin wrinkles immediately, there is no tinting. Now we're going to perform your hair assessment. Upon initial inspection, fine hair is present on all over the body on both upper and lower extremities. I'm going to palpate your head now if you don't mind.
Okay.
Alright, hair is brown in color, medium in texture. There's no presence of infestations, bumps, or lesions. Is there any tenderness while I'm under here?
No.
Alright, there's no tenderness, no pain. Now I'm going to perform your nail assessment if you don't mind. On initial inspection, the nails are clean. They are convex in contour. The angle of the nail bed is 160 degrees. The nail beds are level and firm. I'm going to check your capillary refill right quick if you don't mind. All right, it's less than 3 seconds. There is no evidence of clubbing or hypoxia. Your head neck assessment. The initial inspection of the head is round and symmetrical. It is midline on the body. The scalp has mobility. There are no obvious masses or lumps on the skull. There is no abnormal hair distribution on the body, and the face has symmetrical movements. Can you open your eyes for me? All right, can you smile? Okay, yeah, the face has symmetrical movements, and the facial structure, such as the nose and the ears, everything is all midline or symmetrical. I'm going to feel your neck and trachea. The initial inspection of the neck has no obvious masses, lumps, no obvious jugular vein distension or goiter. I'm feeling for lymph nodes right now. There are no swollen lymph nodes, and the trachea and larynx are midline. I'm going to palpate your face. I'm going to start with your maxillary sinuses.
Okay.
Is there any tenderness there?
No.
All right, move to the frontal sinuses. Is there any tenderness there?
Nope.
All right, now I'm going to palpate your mandibular joint and check for TMJ. Feeling for any popping or clicking. Will you open and close your mouth, please? All right, was there any pain there?
Nope.
All right, there was no popping or clicking that I felt, so no obvious displacement with TMJ. For this part of your eye exam, we're going to be conducting an eye test on the Snellen chart right here. I'm going to get you to cover up one eye.
Okay.
You're going to read the lowest line that you can, and then you're going to do the same thing with the other eye.
Okay.
All right. So,
B D E F P O T E C.
all right, other eye, please.
Okay. D E F P O T E C.
All right, now uncover your eyes and read it the lowest one you can.
D E F P O T E C.
All right, you have read line 8, you have 20/20 vision. All right, now continuing on with your eye exam, we're going to go to the corneal light reflex. Just start this wall right behind me. All right, there's parallel alignment at 2 o'clock. I'm going to check your sclera. Sclera is smooth, white, and glistening. I'm going to check your conjunctiva. You'll look straight up for me. Conjunctiva is smooth, pink, and moist. Is there any tenderness when I do that?
Nope.
All right, now I'm going to do your parallel exam. Start to end this pen for me. All right, pupils are equally responsive to light, they equally constrict bilaterally, and they equally accommodate. All right, now we're going to conduct your ear assessment. We're going to begin with the whisper test. We'll go cover one of your ears, please.
ABC.
Other ear, please.
1, 2, 3.
All right, you have passed the whisper test. Now we're going to continue with the inspection of the ears. The initial inspection, the ears are symmetrical. They're at a 10-degree vertical angle. There's no apparent discharge or redness. I'm not going to palpate your ears, that's okay.
All right.
All right, is there any tenderness here?
Nope.
All right, the ears are very soft, they are very pliable, and they're very non-tender. I'm now going to assess the patient's external auditory canal. If you will turn your head this way slightly for me, because he's an adult, I'm going to pull up and back. All right, upon initial inspection, the external auditory canal is unobstructed. The tympanic membrane is translucent and pearly gray. Does not appear to be any redness or drainage. You can inspect the other side now. If you will, turn it slightly that way, up and back. Again, the external auditory canal is unobstructed. There appears to be no drainage or redness, and the tympanic membrane is translucent and pearly gray. All right, now I'm going to conduct your nasal exam. If you don't mind tilting your head back for me. Okay, nasal mucosa is pink and moist. The septum is midline. There's no apparent discharge, and the nares are symmetrical bilaterally. Going to the outer structure of the nose is midline on the face. I'm going to palpate if you don't mind.
All right.
Any tenderness?
Nope.
Okay. I'm going to check for nasal patency now. Breathe in for me. Breathe in for me. Nasal patency is clear and the patient can breathe with it's unobstructed. I'm going to conduct your oral exam. Upon initial inspection, the lips are pink and moist. They are symmetrical to the face. If you open your mouth for me right quick. The oral mucosa and the tongue is pink and moist. The tongue has full mobility. The teeth are in good repair. They are white in color. Enamel appears to be intact. Now I'm going to inspect your uvula and tonsils. I'm going to use this tongue depressor. Say ah, please. The uvula is pink and moist, and it rises and falls with vocalization. Open one more time. And the tonsils appear to have been removed. Conduct your cardiovascular exam. On initial inspection, the patient's skin color is even on both upper and lower extremities. If you don't mind, let me palpate your skin temperature. All right, skin temperature is warm to the touch. On both upper and lower extremities, there's no edema present. If you don't mind, let me inspect your nail beds. All right, nail beds are clean. They're 160 degrees in angle on both upper and lower extremities. I'm going to check your capillary refill now. All right, capillary refill is equal bilaterally in less than 3 seconds on both upper and lower extremities. Now I'm going to palpate your pulses if you don't mind.
Okay.
Start with the temporal. Temporal is equal bilaterally plus 2. I'm going to move to the carotid. Carotid is equal bilaterally plus 2. I'm going to move to the radial. Radial is equal bilaterally plus 2. I'm going to finish with dorsalis pedis. Dorsalis pedis is equal bilaterally plus 2 as well. Now I'm going to move to auscultating your heart sounds.
Okay.
We're going to start with the aortic. Move to the pulmonic. And into the herbs. Then tricuspid. Then to the mitral, which is the apical pulse site where you normally listen for 1 full minute, but for the sake of this video, we will not do that. All right, heart rate is regular and strong. No clicks or murmurs were heard, and S1 and S2 were heard at all auscultation sites. Now I'm going to conduct your pulmonary assessment. Upon the initial inspection of the patient, his chest rises and falls symmetrically. It does not appear to have any barrel chest or pigeon chest. The anterior-posterior chest ratio appears to be a 1 to 2. Does not appear to have any labored breathing. He's sitting in a comfortable upright position, and breathing appears to be effortless. I'm going to assess your posterior thorax. Upon the initial inspection, the patient's posterior thorax rises and falls symmetrically with breathing. I'm going to do some palpations now, if you don't mind. Let me know if there's any tenderness.
No tenderness.
Okay, no tenderness noted upon palpation. I'm going to percuss. All right, there was resonance heard all throughout the body. No hyperresonance or dullness was heard. I'm now going to auscultate. Take some deep breaths when you feel my stethoscope touch you. side for me. If that'll come up. All right, clear breath sounds were heard all throughout the body bilaterally. There was no abnormal breath sounds, no wheezing, ronchi, or crackles were heard. All right, now I'm going to assess the patient's posterior chest excursion. Take a deep breath for me. All right. Chest excursion was equal bilaterally. Equal pressure was felt symmetrically bilaterally as well. I'm now going to assess the patient's anterior thorax. Upon initial inspection, the patient's chest is symmetrical and rises and falls symmetrically with breathing. I'll do some light palpations now. Let me know if there's any tenderness.
No tenderness.
All right, no tenderness noted upon palpation. I'm now going to percuss. All right, upon percussion, resonance is heard all throughout the body, symmetrically, bilaterally. There's no hyperresonance or dullness heard. I'm now going to auscultate. Deep breaths when my stethoscope touches you. This arm up, please. Clear breath sounds were heard all throughout the body, bilaterally. There's no abnormal breath sounds, no wheezing, crackling, or ronchi. I'm now going to test your chest excursion right quick. Just take a deep breath for me. All right, chest expansion is bilateral, it's symmetrical, and equal pressure was felt bilaterally. Now I'm going to perform your abdominal assessment. Upon initial inspection, the contour of the patient's abdomen is flat and symmetrical. There is no guarding, there are no obvious masses or lesions, there is no distension, there are obvious pulsations. Now I'm going to auscultate your abdomen. You would normally do this for a lot longer, but for the sake of this video, we are not going to. I'm going to begin in the right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. Audible bowel sounds are heard every 5 to 15 seconds. Now I'm going to percuss your abdomen. Starting in the right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. Sounds of tympany with dullness were heard over organs. Was there any tenderness when I did that? Okay, now I'm going to palpate. Let me know if there's any tenderness.
Okay.
Good?
Yep.
Good?
Yep.
Good?
Mm-hmm.
Good?
Mm-hmm.
Abdomen is smooth and non-tender with no pain upon palpation. From there, I would move on to deep palpation, which would be where I would palpate deep into the abdomen with a dipping motion, 4 to 6 centimeters, to palpate organs or masses. Now I'm going to assess your musculoskeletal system. On initial inspection, the head is midline, the shoulder, scapula, and the iliac crest are symmetrical, the tail is midline, and the skeleton and the extremities are symmetrical. Abduct, adduct, flex, extend, hyperextend, palmar reduction. Flex, extend, hyperextend, move side to side. Bend, extend, supinate, pronate. Forward, backward, abduct, adduct, internally, externally rotate. Flex, extend, hyperextend, move laterally, rotate side to side. Bend forward, extend, hyperextend, move laterally, and rotate from side to side. Extend, knee to chest, hyperextend, abduct, adduct, externally, internally rotate. Flex and extend. Dorsiflex, plantar flex, evert, invert, abduct, adduct. Flex, extend, hyperextend, abduct, adduct. All joints have full range of motion. To assess your muscle strength, please shrug your shoulders for me. Okay, stick your arms out and curl them upwards. All right, push my hands back. There's no muscle weakness noted in the trapezius, biceps, or the triceps. All right, now we're going to do your neurological assessment. First thing I'm going to do is a Romberg test. If you will, you stand up for me. Okay, hands by your side, eyes closed. All right, Romberg test is negative. You can have a seat. All right, now I'm going to test for superficial sensations. If you will, just close your eyes, and whenever I touch you, just point to wherever I touch you, said now.
Okay. Now. Now. Now.
All right, patient can identify light touch. All right, now close your eyes and tell me whether the sensation is sharp or dull and where the sensation occurs.
Sharp. Sharp. Sharp.
All right, patient is able to identify the area of sensation and the type of sensation. Now we're going to test your deep tendon reflex. All right, DTR is bilateral plus 2. All right, now can you put your palms up, close your eyes, and tell me what I draw on your palms.
Triangle. Circle. Heart. Square.
All right, graphesthesia is bilaterally intact. All right, I'm going to get you to lay down flat for me. All right, can you raise your head up? All right, Brzezinski meningeal test is negative. Cranial nerve 1, olfactory nerve. Cranial nerve 2, optic nerve. Cranial nerves 3, 4, and 6, oculomotor, trochlear, and abductions nerves. Cranial nerve 5, trigeminal nerve. Cranial nerve 7, facial nerve. Cranial nerve 8, acoustic nerve. Cranial nerves 9 and 10, glossopharyngeal and vagus nerves. Cranial nerve 11, accessory nerve. Cranial nerve 12, hypoglossal nerve.